So I'll be talking about the abdominal structures that you can see on the CT. I'm using Radiopedia, and both of these are open source and they come from Dr. Craig Hacking, so thank you. This on the left is the upper portion and this on the right is the lower portion, so the very bottom of this one continues off here. So to start off with, let's just kind of review the basic structures that we see here. We see the heart and the aorta, and we start to see the liver here as we migrate inferiorly in the bottom portion of the liver. We can see here the rectus abdominis, and as we continue inferiorly we can visualize the external and internal obliques and the transversus abdominis, and we can see the linea alba. So if we look here as we go down inferiorly, we can start to see the stomach and the spleen, and we know that the spleen sits posterolaterally to the stomach. And starting here, we can see the esophagus. And so if we head towards the feet inferiorly, we can start to see that the esophagus comes down and joins the stomach here at the gastroesophageal junction. Here is the fundus of the stomach, and here's the body of the stomach. We can see here the kidneys, and if we follow along with the aorta, we can see here the right renal artery crossing over and attaching to the aorta. And if we follow the other kidney, we can see the left renal vein crossing over and joining with the inferior vena cava. And here is the right renal vein. And the renal artery. So if you just look and follow here, this is the superior pole of the kidney. The left is a little more superior than the right. In the back we have the erector spina muscles, and we can see the edge of the ribs, the body of the sternum, which comes to a point at the xiphoid process. If we follow along from the beginning of the liver, we know that the superior portion of the liver touches the diaphragm. So the diaphragm's kind of going along with the liver as it descends. And eventually we get to a point where we can see the right and left cruce of the diaphragm and the aorta. And other important structure we know is the hepatic portal vein system. We can see the left and right, with this being the left lobe of the liver and this being the right. The hepatic portal vein, eventually a branch off that is the superior mesenteric vein. We know that if we follow along with the right atrium, eventually the superior vena cava, which runs through the right atrium, becomes the inferior vena cava. And we have the right hepatic vein, middle hepatic vein, and left hepatic vein. So they drain the blood from the liver back to the vena cava, while the hepatic portal vein system had brought blood into the liver. These are just pulmonary vessels here. We know that the posteriorly to the inferior vena cava, we have the azygos vein, and we can see the hemiazygos vein right here. We can see here the spleen and the splenic artery and the splenic vein. If we look here, we can start to see, as we go inferiorly, we can see the tail of the pancreas in the body and the neck. And so if we just track along with the aorta and the vena cava at the end here, aorta, vena cava, that continues here, aorta, vena cava, we can start to see the aorta branch into the right and left common iliac arteries, which then subdivide into the external and internal iliac arteries, which eventually become the femoral arteries. Now if we go back up here, you can, as we descend, right, and we fall along with the stomach, you start to see the top of the transverse colon. So the stomach is more medial, and as we descend inferiorly, we begin to see the tip of the transverse colon, and remember on the left side it's called the left colic flexure, also known as the splenic flexure. And if you remember your transverse colon, where this is the left and this is the right side, and your transverse colon is here, the right side joins with the ascending and the cecum, and the cecum joins with the ileum of the small intestines, wrap around descending colon, which adjacent to it posteriorly is the sigmoid colon, which goes down to the rectum. So if we follow along with the transverse colon here, descending colon, we can make our way, follow along here, sigmoid colon, down to the rectum. Going back up. All the way up to the splenic flexure. So let's now move on to the other side. So moving inferiorly past the liver, we can start to see the shadow forming. That's the gallbladder. We have the head and then the fundus of the gallbladder at the end. As we continue onwards, we will see this, which is the hepatic flexure, the right end of the transverse colon. And we know as that continues, the ascending colon will meet the transverse colon before it goes across, and then down the descending colon to the sigmoid colon to the rectum. So here we can see ascending colon, ascending colon, ascending colon, continuing on the other side, ascending colon, and eventually it becomes the cecum. And here we can see the ileocecal valve, which connects the cecum to the valve between the cecum and the ileum, the small intestine. And we know that the cecum continues inferiorly, eventually coming to a stop at the end. And it has a little appendage off of it, And that's the appendix right there. Something important to note is the umbilicus here, which occurs at the level of the third lumbar to fourth lumbar vertebra, sometimes L4 to L5, and around the L4 level you start to see the iliac crest, the hip bone. We can see here at the end the bladder, and going back here, let's go back to the stomach. So remember, we have the stomach, the spleen, the fundus of the stomach, the body of the stomach. Eventually we hit the pylorus, and the pylorus is connected to the duodenum. So if we follow along the duodenum, eventually the duodenum will connect to the jejunum, which is around here. You can kind of see a bridge there. The duodenojejunal flexure. And then the jejunum will continue on the other side. Other things to note are the renal pelvis, and the cosodiaphragmatic recesses, which are where fluid accumulates in case of pneumonia. That's it for now.